Are your knees aching when you get out of bed? Do you have pain climbing stairs, or even after you've just been sitting too long? 1 out of 4 adults in the US has knee pain, and that's risen by 65% over the last 20 years. What's going on, guys? This is Dr. Schilling from Secoya Health, and today we're talking about what are the 5 most common causes of knee pain. Now, these might surprise you, but some of them are pretty self-evident. So, what really lies behind knee pain is not actually the knees. What we're looking at is a functional approach here, understanding what's the whole picture looking like. We want to go beyond the symptoms. So let's get into rule number 1, or cause number 1. That's inflammation. Inflammation, you think it's in the joint, but oftentimes we put grease on the squeaky wheel. So what happens is your knee aches and you go get a sleeve from the Dick's Sporting Goods or whatever because you feel like that's going to help you. Or you might get a massage, something like that, hoping it's going to help. And the real problem is the knee is just the campfire, right? The inflammation is really what's stoking that fire. And the number 1 cause of inflammation is actually coming from your gut, if you might imagine. That's a surprise to a lot of you, but it is. Gut inflammation turns into joint inflammation. Now, knees are a little bit different, but a knee is like a fire you have burning in your body, and your body's trying to get your attention. Now, there's a bunch of different reasons, but if you don't attend to it over a long period of time, it's end up going to causing you probably a significant injury. Some people, my father's had his knee replaced, and I think his second knee replaced for that matter. So you want to stay ahead of this because it's not something to play with. So cause number 2, muscular imbalances. So when your muscles are imbalances, your joints can't move properly. So think about it this way. If you didn't have muscles right now, you'd be a sack of bones and skin on the ground. You couldn't move, you couldn't breathe, your heart wouldn't be there because it wouldn't be pumping, it's a muscle. So you need to know that your joints are the hapless bystanders when it comes to joint pain. So if your muscles weren't imbalanced, your knees would not have pain, okay? Think of it as muscles constantly compressing and pushing these knees together, which ends up wearing them down over time. That could be a muscular imbalance from sitting too long all day. For example, your glutes might shut off, your extensors or your flexors might be fired all day, your psoas is pulling your hips down. So it really depends on what your muscular imbalance is, and you want to work with a qualified professional in your area to figure that out. But tight hip flexors and weak glutes, that's a guaranteed combination. The knee is like the middle child, okay? It is stuck between the hip and the foot, both of which can cause a lot of problems for you. Excuse me. So don't expect that the knee is the problem. It's really oftentimes just a check engine light. It absorbs a lot of stress that it's not supposed to handle when the glutes and or the feet are not working properly. So let's talk about it a little bit further. We talked a little bit about inflammation a second ago, which comes from gut inflammation, things like that. But metabolic dysfunction, which is carrying extra weight and things like that, that's a big challenge for a lot of people because for 1 extra pound of body weight you carry, that's 4 extra pounds estimated weight on your joints. And that's just more than anyone can handle for that matter. So do your best to reduce your fat cells, make them shrink, work with someone in your area to figure out what your limitation is, whether it's your thyroid or your gut microbiome, detox pathways, whatever it might be for you. If your hormones are all jacked up, figure that out with somebody in your area because inflammation in your metabolic systems is directly going to attack that cartilage because your body's just going to break it down over time. So let's talk about cause number 4, which is just wear and tear. I played college football, so I played on AstroTurf back in the 90s. And I can tell you that if your skin wasn't left on the ground from sliding on that turf, that unforgiving, now they have sport turf, which is way different than AstroTurf. AstroTurf is like, bam, you're just crushing your joints. But osteoarthritis affects somewhere between I think it's about 32.5 million people in the US right now. That's, 32.5 million out of 330 million, that's a lot of people. So they have wear and tear on their joints. And it's not inevitable because of aging. It really isn't because I'm 47. And if you saw a previous video, I basically box jumped up onto the 36-inch counter and then did a 1-legged pistol squat up. Now, that's not for everybody. And if I can do that at 47, it's not an aging thing because I take exquisitely good care of myself as far as keeping my inflammation low. You can do that too. You might need some help, but we can do that for you. We can help teach you how to do that because you want to have that skill for the rest of your life. But you want to prevent injuries by having a balanced brain. We talk about brains here all the time, and balanced joints. So when your brain is balanced, your muscles are balanced. And when your muscles are balanced, your joints are balanced. So I want to encourage you to stop chasing the joint pain and start looking at the muscular imbalance, which then might lead into a metabolic imbalance and eventually a brain imbalance. All can be overcome, all can be remedied. Don't worry, you're not lost, you're not SOL, you're not out to lunch, if you will. But learn the proper movement patterns. Learn the exercises that you can do to stabilize your body. Super important. Okay, so number 5, modern lifestyles. Most of us, I mean, I wouldn't include myself in that, but average Americans are sitting about 10 hours a day at least. Now that's typically at work. Then they go home and they watch, on average, 3 to 4 hours of TV a night. Now, if that's not you, fantastic. Don't worry about it. And if it is you, then you know you're going to have some deconditioned muscles. Your brain's going to start having muscle amnesia. It's going to come down to you forgetting about how to move your body, and your brain's just going to say, well, I guess we don't need these muscles. We're going to start shrinking them down. You're going to get sarcopenic. Your body's going to break down and lose muscle tissue and stuff like that. But it creates a perfect storm. Deconditioned muscles, atrophying muscles, metabolic nightmares, inflammation, wear and tear on it. So that, then let's say you're the weekend warrior, you get up and you try to go out and have fun, and guess what? You try to activate it and something pops, something doesn't move properly, you strain something, oh, my hammy, whatever it might be, your low back. So the good news is, at least here at Secoya Health, we take a holistic functional medicine approach. Like when I say functional medicine, I'm thinking about systems. Don't think about prescriptions or supplements. Think about a functional medicine approach is like, what are the systems connected? What's the hip connected to? And I don't mean, the leg or the torso. You want to understand, for me, I look at conventional medicine is just going to mask the symptoms. It's going to give you a painkiller. It's going to give you a muscle relaxer. It's going to send you to PT to strengthen or lengthen something. They hopefully will help you with your movement patterns. However, typically it's a strengthening or lengthening kind of thing. And if you're not focused on what am I putting in my body, nutrition-wise, healthy food, how am I reducing toxins in my products I'm putting in my body, how am I reducing my stress so that my mind is clear and my body stays healthy. All super important things. Am I moving my body correctly? Am I not just sliding a sleeve on my knee in order to maintain my activity thinking, oh, I'll just need a little extra support. If it's screaming at you, you need to get help with someone who's qualified to do that, okay? You gotta reduce that systemic inflammation, helping your body heal itself more importantly, okay? So, I'm sure if you have knee pain and you're watching this video, then you understand that there are a bunch of different reasons why. And it can be very confusing and very complex, and I'm sure, we always say if you're an intelligent person, if you could have figured this out by now, you would have. But there's some little dot you haven't connected, some T you haven't crossed, an I you haven't dotted, something like that, you need some help. So what I would suggest is you work with someone in your area, and if you're in the Woodbury area, fantastic, give us a call. I'll be happy to help you with that because it's not that complex, and we have the tools to make sure you're healthy now and for decades to come. So what I want to encourage you to do is DM us on Instagram, knee pain. So KNEEPAIN, knee pain on Instagram. And what I'll do is I'll send you a link, which is going to allow you for the opportunity to schedule a complimentary consultation with one of our team members to actually determine whether A, you're a candidate for one of our programs, and B, if you have the conditions that we can serve. Because we don't want to waste your time, and we don't want to drag you through a process that's not going to help you. So our team is experts in figuring out what services you need after we've determined we can help you. So I just want to encourage you to DM us on Instagram, knee pain, and we'll go ahead and get that scheduled up for you, that complimentary consultation, okay? Hopefully this helps. Hopefully you're inspired to take some action on the 5 main things that are causing inflammation in your knees. And for now, we'll sign off. All right, make it a great day. Cheers.